Urolithiasis or kidney stones, part 3. Here we'll talk about the management of the acute renal colic. If the imagine a patient coming with lot of pain, blood in the urine, and you suspect there is a stone in the urinary tract, and the first most important thing what you're gonna perform is non-contrast CT of abdomen and pelvis. That's the first thing you want to do, and remember it is a non-contrast one, because in contrast you won't be visualize the stones. So non-contrast is very important. Let's see if CT confirms the stone, if there is a stone. Now there is a urgent pathway and non-urgent pathway. Urgent pathway when it is obstructed or the infected upper tract, impeding the renal deterioration and intractable pain, nausea, emesis, fever, patient preference, solitary kidney, hemodynamically instability. So these are the factors which will lead, which wants us to go for the urgent pathway, and the urethral stent, or we could see the urethral stent performed or the percutaneous nephrectomy tube to be placed, and then we delay the elective stone management. So for urgent, you can put the urethral stents or the percutaneous nephrectomy tube, and then you delay the elective stone management. If it is a non-urgent pathway, you have to assess the likelihood of spontaneous stone passage. And how can you assess it? By looking at the size, location, and duration of the symptoms. Now you can either observe the stone passed, submit for the analysis, consider the metabolic evaluation, or what you can do is you perform x-ray of the kidney, ureter, bladder for stone monitoring, and then trial of passage for 2 to 4 weeks. And if stone still has not passed, you can move to the intervention part. In intervention part, again you assess the stone size, location, composition, renal anatomy, and if the stone is less than 2 centimeter, you can do is the weight. If it is less than 2 meter, you can do the management by giving the hydration, the URS and ESWL. So here the URS refers to the ureterorhinoscopic approach, or you can do ESWL, which is extracorporeal shock wave lithotripsy. If it is a small, less than 2 centimeter of size, if stone is 2 centimeter or greater, then you will have to do PCNL. So here the PCNL refers to percutaneous nephrolithotomy, and this is how you manage the non-urgent pathway. If no stones are seen on CT and there is presence of hydronephrosis, you will go for the determination of the cause. It could be somewhere obstruction, the urethral mass, or the vesico-urethral reflux. If there is no hydronephrosis, then you can consider the pyelonephritis or non-urological cause of the flank or the abdominal pain. So this is the pathway how you can just follow how to manage the acute renal colic. That completes our kidney stones. Thank you.